Has someone you love begun showing small but worrying changes over the past year? Many assume elderly people pass away suddenly, but the truth is the body often whispers warnings months, sometimes a full year, before life reaches its final chapter. The problem? Most dismiss these signs as insignificant at first. Only later do families realize the clues were there all along. But by then, it's too late to prepare, too late to create meaningful final memories. In this video, we'll discuss 5 crucial signs that frequently appear about a year before an elderly person's passing. Some might be changes you've noticed but dismissed as normal aging. Others could seem minor but actually signal the body's gradual shutdown. Recognizing these signs early lets you provide better care, treasure precious moments, and most importantly, ensure your loved one's final days are filled with comfort, dignity, and peace. Stay until the end. Understanding these 5 signs helps you prepare emotionally and practically. When you know what's happening, you won't be blindsided. You'll be able to make the most of the time remaining with those you cherish. Now, let's begin. Sign number 1, dramatic weight loss. One of the earliest and most telling signs that someone may be entering their final year is unintentional weight loss. At first, it seems minor. A belt needing extra holes, looser clothing, or a once strong appetite fading. Families often brush this off as normal aging, but unplanned weight loss is rarely harmless. It typically means the body can't absorb nutrients properly. Muscle mass is decreasing, and vital systems are slowing down. While some muscle loss comes with age, rapid depletion signals deeper issues. The body may struggle to digest food or process protein effectively, leading to muscle wasting. This weakness isn't just about mobility. It raises fall risks, weakens immunity, and increases infection vulnerability. Appetite changes also contribute. Many seniors simply stop feeling hungry. Taste buds dull, food loses appeal, and meals get skipped or minimized. This isn't pickiness, it's physiological. As the body prepares to shut down, it stops signaling hunger normally. The result? Less energy, dwindling strength, and overall health decline. Underlying conditions often accelerate this. Weight loss commonly accompanies cancer, heart failure, kidney disease, and other chronic illnesses long before other symptoms appear. Even depression or dementia can reduce eating, creating a dangerous cycle where the body lacks fuel to function. Well-meaning families often push more food, favorite dishes, protein shakes, frequent snacks. But when weight keeps dropping despite these efforts, recognize this isn't just about diet. The body is beginning its final transition. At this stage, comfort foods and hydration matter more than large meals. If your loved one is losing weight rapidly, eating less, or struggling to stay active, pay attention. This isn't merely physical change, it's the body sending signals. Understanding these signs now helps you prepare for what's ahead with clarity, compassion, and the chance to make every remaining moment count. Sign number 2, profound exhaustion. One of the most noticeable changes in the final year is an unshakable fatigue that rest doesn't relieve. This isn't ordinary tiredness. It's overwhelming exhaustion, making simple tasks daunting. Getting up, walking across a room, even conversing becomes draining. This happens because as organs slow, the body conserves energy. The heart pumps less efficiently, circulation weakens, and muscles get less oxygen. The result? Weakness, unsteadiness, and inability to maintain former activity levels. Metabolism also shifts. Instead of fueling movement, the body redirects energy toward essential functions. Many sleep more, needing frequent naps and struggling to stay awake long. Some experience sudden energy crashes, alert one moment, completely drained the next. The emotional toll is heartbreaking. Seniors who prized independence grow, frustrated or ashamed by their limitations. They may withdraw from conversations, socializing, or hobbies, not from disinterest, but sheer exhaustion. This isolation often accelerates decline. Watching an active loved one become withdrawn is painful. While tempting to push them to stay active, forcing exertion won't help. What matters most is understanding their limits, allowing rest, and making their days comfortable. If you notice unrelenting fatigue that sleep doesn't ease, recognize this as the body's natural transition. Cherish quiet conversations, create peaceful moments, and offer support without expectations. Ultimately, what matters isn't what they can do, but that they feel loved, understood, and at ease. Comment number 2 below if you're finding this helpful. If you haven't subscribed, please do and enable notifications. Your support helps us create more meaningful content. Sign number 3, mental confusion or withdrawal. As life nears its end, noticeable changes often occur in interaction. Someone once sharp may forget things, struggle to follow talks, or seem disoriented in familiar places. They might repeat themselves, forget names, or lose track of time, even with no prior memory issues. These cognitive shifts can begin a full year beforehand. This isn't normal forgetfulness. As circulation weakens, the brain gets less oxygen and nutrients. Thinking becomes cloudy, decisions grow difficult, confusion flares, even loved ones may seem unfamiliar. Some alternate between lucidity and disorientation, as if their mind flickers in and out. Emotional withdrawal is equally common. Many lose interest in socializing, talking less, engaging minimally, or sitting silently for hours. This isn't rejection. Their brain processes interaction differently now. Conversations tire them, noise overwhelms, and many retreat inward. Mood changes often appear too. Some grow irritable, anxious, or frustrated. Others become unusually calm or indifferent to once important matters. These aren't personality shifts, they're the brain adapting to the body's decline. As cognition slows, emotions become harder to express. For families, this stage proves particularly hard. Watching a loved one mentally slip away feels like losing them twice. But remember, they can't control this. Rather than forcing engagement, meet them where they are. Speak gently, offer reassurance, and understand that even if they don't respond, they still feel your presence. If your loved one grows increasingly forgetful, confused, or withdrawn, don't ignore it. These are often early signs the mind and body are preparing for transition. Now is the time for patience, quiet companionship, and creating a safe, peaceful environment. Even when words fail, love and comfort still resonate. Sign number 4, recurring infections and slow healing. As the body winds down, one clear physical sign is weakened immunity. Someone who rarely fell ill now catches every cold, flu, or minor infection with slower recoveries each time. Simple cuts or bruises heal sluggishly. These aren't random changes. They show the body can no longer defend or repair itself effectively. Frequent infections become concerning. Pneumonia, UTIs, skin or oral infections strike often and linger. Antibiotics that once worked quickly now prove less effective, requiring stronger or repeated treatments. This happens because as circulation slows and organs weaken, the body responds poorly to medications. Chronic wounds also develop. Minor scratches, sores, or bruises don't heal properly or keep reopening. Poor circulation means oxygen and nutrients don't reach tissues efficiently. Pressure sores become serious risks for less mobile individuals, potentially leading to dangerous infections if untreated. Alarmingly, infections in the final year often present atypically. Instead of fever, an elderly person may just seem more tired, confused, or disinterested in eating. In fact, sudden mental decline is often the first infection warning before other symptoms appear. While families naturally want aggressive treatments, sometimes comfort becomes the priority over cure. Keeping skin clean, ensuring hydration, and minimizing stress often help more than medications that prolong suffering. If infections become frequent and healing slows significantly, it may signal the body's final preparations. Sign number 5, breathing and circulation changes. Among the clearest signs the body is preparing for its final stage are noticeable shifts in breathing and circulation. Breathing may become slower, shallower, or irregular, with occasional pauses. Some develop Cheyne-Stokes respiration, alternating deep breaths with long pauses. These patterns start subtly but grow more pronounced. Circulation weakens noticeably. Hands, feet, nose, or ears grow cold. Skin may turn pale, bluish, or mottled, especially extremities. This occurs as the body prioritizes vital organs, reducing peripheral blood flow. It clearly indicates the heart isn't pumping as strongly. Shortness of breath often increases too. Minimal movement, sitting up, talking, or shifting position, may leave them winded. Some breathe through their mouths more or pause mid-sentence to catch their breath. If walking across a room grows difficult, lung function is likely declining. Fluid buildup can complicate breathing, causing persistent coughs, gurgling sounds, or chest tightness. While often mistaken for colds, in the elderly, this typically signals weakening lungs. Many find lying flat uncomfortable, preferring to sleep propped up. For families, these changes can be frightening. The instinct is to help them breathe deeper or worry something's urgently wrong. But often, this is simply the body slowing down naturally. Keeping rooms cool, using humidifiers, and offering small water sips can ease discomfort. Sometimes oxygen therapy helps, but focus shifts to comfort rather than reversal. If you notice breathing changes, cold extremities, or bluish skin, pay attention. These signal the body is conserving energy as circulation slows. Now is the time for presence, reassurance, and creating peace. In these final months, what matters most isn't medical intervention. It's ensuring they feel safe, comforted, and loved. Let's reflect on what we've covered. Dramatic weight loss, profound exhaustion, cognitive decline, recurring infections, and breathing circulation changes. These 5 signs often emerge in the year before passing. They may not all appear simultaneously or obviously, but when noticed, they indicate the body's final transition. For families, accepting these changes proves difficult. The instinct is to fight them, urging more eating, more activity, more resistance. But sometimes the kindest approach is listening to what the body tells us. Rather than reversing the inevitable, we can focus on making remaining time peaceful, comfortable, and meaningful. Understanding these signs isn't about fearing death, but preparing for it. Recognizing them early allows better care, timely decisions, and assurance your loved one's final months overflow with love and dignity. This is the time for treasured moments, shared stories, and showing them they're valued and not alone. If you're noticing these signs in someone dear, remember, you're not alone. Many have walked this path. While never easy, knowing what to expect helps you find strength, patience, and peace. Thank you for joining us. Share one insight you gained below. Your thoughts motivate us. If this video helped, please like, subscribe, and share. Your support lets us create more meaningful content. We appreciate you watching and look forward to connecting in the next video.